Thank you, David. The benefit of coming last is that a number of individuals have touched on key points that are in scope to discuss. But I just want to take on from what David Wood mentioned, that is to say, let's put the problem in perspective. In reality, when we have the well-resourced, and I say well relatively, regulatory authorities, they have a different scope of problems than the resource-constrained environments of the rest of the world. So to really expect that one size will fit all in terms of the recommendations, it's not a reality. So that's one basic fact that is necessary to keep in mind. But before then, I think regulatory work in general, we need a lot of advocacy. Because, again, as David said, we're seen as a roadblock, period, to any new tools being developed. That's what most groups, those who make decisions on financing and so on, that's what they think regulatory is. We don't think it's that way amongst us, but if you step out, that's what we're perceived as. Beyond that, I'm sure if we had to talk to the industry folks in the audience, I'm sure they're not thinking very differently from what I'm saying. So I think the first point I would like to make is to advocate for a real sense of rationalization of why regulatory work is important. Clearly, the value in other commodities where you choose of your own to go on and fly and so on and so forth is well recognized. But when you're ill and you don't have a choice, it's a different situation. So I think this is the first point I would like to put on the table. Secondly, we have an economic reality which dictates that it's just not possible for us to anticipate that every region of the world is going to be like EMA or FDA. It's impossible. So what is the next best thing? And how can we build upon the resources that are available globally? Thank goodness they're there. And it's very, I think, encouraging to see that the major regulatory authorities of the world are reaching out and are ready to go into the international arena to build support and build systems, build capacity. And I think it's the responsibility of the resource-constrained environment to also consider this issue amongst themselves and determine what is it that is most important for us. It's not taking or buying into every single aspect of ICH. That's not really necessary. So point number one, in terms of moving forward, it's recognizing and utilizing reference agency work for areas and regions that do not have the resources to contribute to the exhaustive, innovative, scientific, technical rigor that is required to regulate a new product. There's just no expectation from a realistic standpoint that that can be done in every single country. So can we find a way to segregate that arm of regulatory work to those who have the full array of resources to do that at this time and recognize as much as possible what has been done by them? We need a system that can really craft that as a way to move forward, as a framework. Secondly, from the resource-constrained regions standpoint, how could we guarantee that any additional value that is required that has not put their own needs and consideration into the original work done by the various agencies can be done. Who will do it, and how can we share it? I think that's an issue that remains a big one. When it comes to a vaccine being developed and is registered, licensed by the FDA or EMA, of course it is for the citizens of the region that EMA has authority over and FDA does. It may not necessarily complete the programmatic suitability that is required for vaccines or other technical issues such as stability at different temperatures and humidity that's required for these other countries. Who does those? How can we, more smartly as a world, and we're all in this together, believe me. How do we put our heads together to say, how can we address those issues? And then, secondly, from the resource-constrained regional standpoint, what is it that we're ready to really, trade off? As sovereignty is important, but these health tools are important to us as well. So what are we ready to concede and say, we don't have to repeat this ourselves? We must have a list of those kinds of items that we're ready to accept. So the principle of registration that Singapore uses now, it's an extraordinarily promising one, where it's a tiered approach, and the Singaporeans are here to talk about it outside of here, but it clearly delineates the level of work and the level of resource utilization, technical skills implementation that you need to have in-house for any product, based upon has a lot been done elsewhere, so we can conserve our resources and focus on what is really needed. So let me move on to data sharing. I think to a large extent, this is another area that collaboratively we need to start looking at. How can we pool data that would be accessible to a variety of people so they don't have to repeat what somebody else has done or have some sense of what aligns with their own vision or does not. The PICS system is quite good from a GMP perspective, but I think the low-income countries, the resource-constrained nations will be very quick to tell you that, unfortunately, the manufacturers, when coming to them with their own products, bring products that come from a different facility, sometimes even from a different country. So that's an issue that PICS system has a way to address some of it, but not all of it. Next point, I think we need to have a good conversation with the breadth of stakeholders that are involved. That is to say, those who are the engine behind innovation and the generation of these tools, industry. We have to be more aligned with, or at least have real frank discussions with what is it that will help them, rather than see us as the constraint in their wish and in their vision to develop products for the communities. More dialogue with them will help. So, I mean, just to summarize, the economic reality of the globe dictates that, we just have to, one size won't fit all, and we have to decide, and each region has to decide and prioritize what to do. And recognition of reference agency work is critical and important, and we need to have a framework to justify the regulatory necessity that we are all trying to push. Thanks.
Well, obviously, all of our panelists have given a lot of serious thought to the solutions to the challenges of harmonization. I want to thank them all for finding some space they must have found last night to think about this hard and propose some interesting thoughts and ideas. So we have now time for questions from the audience, please, until 11:30, so we have plenty of time. Please give your name and affiliation before you ask the question, and address it to one or more of the panelists. So,